I'm joined now by the President of the Australian Medical Association, Dr Tony Bartoni. Doctor, thank you for your time again this morning. You've been a wise and, I think, considered voice through this crisis, but still every day we're hearing more and more horror stories and more families are going through unimaginable pain. This communication, as we just saw, is just terrible. And our most vulnerable people are suffering. They're dying. They're dying alone. So all we saw yesterday was a blame game, frustration, anger spilling over. I wouldn't let my mum in one of those places was a brutal takedown.
Good morning, Colin. Thanks for having me back on again. Yes, it was fairly emotionally charged, this debates yesterday, but what we all need to remember is that we're talking about the most vulnerable of all Australians in a sector that's been really significantly under duress for many, many years before COVID-19 came along. What we need is that whether we're a premier, a minister, a doctor, a nurse, we're all tired, we're all on the front line, we're all trying to do the best for our patients, for the system, and now's not the time to really let emotions fly. There'll be some strong words said, but that's just a reminder that we need to get on and work coordinatedly and collaboratively to do the best thing by our patients, our residents, our community in Victoria.
OK, look, I genuinely feel the pain of these people in having to say goodbye to their loved ones. And I mentioned it yesterday over FaceTime. And for these loved ones to be in these facilities and passing away with no family with them is beyond grief. Today, a federal task force of doctors, nurses and military personnel, they're going to go in, but why didn't this happen weeks ago?
So, Carl, this is really part of all the questions that will be thrown up, and when we come through the end of this, we'll obviously have to have a very close look at the events. But what's clear and has been presently obvious to people like many of the people watching into the sector at this stage, that we had a workforce shortage going into COVID-19. COVID-19 infected, it started in the community. It was that community transmission that got in. Once it was always a possibility that it was going to get into aged care facilities, and once it did, staff and then residents became infected. But when you take out severe numbers of staff at very short notice out of a system that's understretched, you are going to get this. And this is where we suddenly realise that with the enormity of the shortage of workforce, when those numbers, several hundreds, and then the contacts of those several hundred being pulled out very, very quickly, you end up with whole facilities having to be supplemented with new staff. Okay. And that creates new problems in itself. Very
well explained. But we still have, there could be in facilities across Victoria right now, our most vulnerable who aren't being fed, who aren't being washed, who are lying there literally with no one around them because there aren't enough staff. There are these crack teams we hear of medical officers going in there to Victorian facilities today, but are they going to get looked after, these people? Is this going to sort the crisis out?
And this is why the coordination centre that was announced is really having to bring all of the additional staff. We know they're on their way from interstate, the ADF, the medics, the AUSMAT team, the staff that are being redeployed from the wards that were with elective surgery being put on hold as of yesterday. These are things that should have happened earlier in terms of the coordination, but they're happening now. It's going to take a time to implement and coordinate and insinuate them through the system. To those families, I can only imagine the grief and the anguish that you're going through. Nothing could be worse than what you've just described, and we need to all work as quickly and as effectively and as collaborative as possible, and the communication must be underpinning that. We need to keep the families in touch with what's going on.
100% right. And we would have thought that would have happened before now. We know that there are some concerns from ADF going into these facilities, and also why wouldn't you be concerned if you're a member of these crack teams going to these facilities now that they're going to get this virus? I mean, what assurances are there? And I know you want urgent evaluations of every nursing home in Victoria. That's got to happen.
So the 2 points there. I mean, the correct teams, they are the best of the best. They were part of the returning quarantine international travellers back into Australia earlier this year. They know how to deal with the requirements, and they'll do their obviously the level best ensuring infection control. But in terms of the evaluation, of course, in Victoria, the Victorian centres can only be evaluated. The public facilities can only be evaluated by Victorian government. Of course, this is largely a federal government domain with more than 90% in that space. But it's when you replace staff at very short notice, it's even just the awareness of the resident. Which resident is which? They don't carry name tags as a rule, and they really need to. You're not aware of their background, their history. You've got to go through the charts. There's an enormous wash-in period, and that's where the risk is. And yes, the crack medical teams are the best of the best, but these residents need everyday nursing care. It's complex care, because aged care facilities now are as much as about, almost step-down hospital care, because they've got complex needs, they're vulnerable, and they need the help that we're talking about.
What you're saying today is that we have a lot of work to do. We appreciate your time today. Thanks again, Tony, for laying on the line for us.
Thank you very much.